Hello and welcome to the Love Mia Vita podcast, sponsored by Fem Pharma. I'm Jerry DiPiano, founder and CEO. Thank you for joining us as we discuss all aspects of women's healthcare. Please note, this podcast is for educational purposes only. Always refer to your healthcare practitioner for personal advice. Hi, this is Jerry DiPiano with Fem Pharma, and I am joined by one of the members of our medical advisory team, Dr. Shawana Moore, who is a professor at Emory University in Atlanta, Georgia. And Dr. Moore, please share with those who may not have met you on previous podcasts a little bit about your background.
Thank you so much, Jerry. So as Jerry mentioned, my name is Dr. Shawana Moore. I am a board-certified women's health nurse practitioner, and most of my work has really focused on the women's and gender-related populations. I have an academic appointment at Emory University, and I also still serve patients clinically in the Atlanta area at Grady Memorial Hospital, as well as a few outpatient freestanding healthcare centers. So I enjoy educating individuals about what's normal and what's not normal and helping to increase knowledge when it comes to women's and gender-related health issues.
So Dr. Moore has been with us as a medical advisory team member since the inception of our business. We're very glad to have you again today on the Love Mia Vita podcast. And today we're going to chat about a topic that women may be concerned about, should be concerned about, and it's really the issue of vaginal bleeding. Now, obviously, we know that women will have bleeding during their menstrual cycle, but there are some different factors that may influence the volume, the frequency, and the duration of that we should be attentive to. So Dr. Moore is going to give us a little bit more of the insights on vaginal bleeding, what's normal and what's not.
Yeah, so it's very important for every individual to understand what's normal versus not normal. And when we think about normal menstruation, it can vary, right? So cycle length, typically normal, can be anywhere between 24 to 38 days, depending on that individual. In terms of how long it may last, it could be between 4 to 8 days. The amount of blood that may come out, so the volume of it, can range anywhere between about 5 milliliters for individuals who have very light cycles, but for some people who have heavier ones, it can go all the way up to 8 milliliters. And then when anything outside of that could be related to something completely different, or anything under that could be related to a medical condition. And how often do we expect it to come? We expect it to come monthly. However, we know that if people are on some sort of forms of contraception or birth control, that there could be an exception to that monthly variation. But understanding kind of what that baseline normal when it comes to menstruating is extremely important, and knowing that it could vary from person to person. So it's very individualized, right? So we give parameters in terms of this is what generally the general population is and ranges people should fall through, knowing that yours will be unique to you. However, these are the parameters we would expect you to fall within.
So when women think about their menstrual cycle, they tend to compare themselves to other women. And as you indicated, this is very individualized. And it also will vary depending upon the age of the individual. So in puberty, your period may be of a certain duration and a certain volume, but as you mature into your 30s, 40s, and we know that perimenopause, or I should say the median age of menopause, is 52 years of age. So leading up to the menopause with perimenopause, it may get more erratic. So perhaps we can discuss that a little bit more so.
Yeah, so absolutely. And if I can just touch a little bit on that adolescent population, and that variation during that time could definitely occur, because that's when individual's body is trying to get used to that normal menstrual cycle, right? So there could be lots of variations before a person in that adolescent category can really say, well, this is how my cycles are. It takes at least 2 to 3 years for that consistency to develop. But once we reach that perimenopausal phase, we do have some sort of baseline, right? An expectation as to when the cycles would occur, how long they would be, how the flow could occur. I think the biggest challenge with the perimenopausal phase is that between 7 to 8 years prior to the onset of menopause, there's this transitional phase. And during that transitional phase, that's when individuals can start having variations to their cycle. So it may not come monthly, or they could have bleeding between their periods. But those things, although normal for the transitional phase of perimenopause transitional phase, they do require further attention and workup, right? So typically they come in and see their healthcare provider, and various tests are ran to rule out other conditions to ensure that it's not related to like endocrine dysfunction, sometimes malignant cancers, or even benign gynecological conditions. But I think the biggest thing is when you get to that perimenopausal stage, typically you've had normal periods, you understand what your specific duration is, when to expect your period, how long it would be. When you hit to that transitional phase, which you already noted, Jerry, that in the US, average age for menopause is 52. So if you just subtract 7 to 8 years from that, during that time period, a person can have irregular bleeding, right? And again, that can be bleeding between periods that last longer. But that does require evaluation from your healthcare provider just to ensure that there's not another cause of that abnormal bleeding versus it being a normal part of the perimenal transitional phase.
So when women are in the early part of the reproductive years, let's say in their 20s, there are times when they may develop irregular bleeding, or and it may actually be dysfunctional bleeding. What are some of the underlying causes that women should be aware of? What are the signs and symptoms of what should women be attentive to?
So I think the biggest thing with abnormal uterine bleeding is the bleeding pattern, right? So is anything that's outside of your normal period. If it lasts longer, if it's heavier than it was previously, if there's bleeding between, or if there's no period at all, right? That's still considered abnormal uterine bleeding. And what we do is we put them in kind of buckets in terms of what could be potentially the causes of it. There can be structural causes that can be in the form of benign conditions or non-cancerous conditions like uterine fibroids, polyps as well, or conditions like adenomyosis or endometriosis. Also, we think about endocrine issues such as PCOS or polycystic ovarian syndrome, thyroid disorders. It could even be related to an individual having a BMI that is considered in the obesity category. And again, that perimenopausal phase could fall under that endocrine bucket. Other things we want to always rule out is pregnancy related, right? If potentially there was a miscarriage or ectopic pregnancy, or it could even be implementation bleeding. Again, I talked about cancerous potentially cervical, right? Endometrial, vaginal, or even something called endometrial hyperplasia, which is really the overgrowth of the endometrial lining that places one at greater risk for development of endometrial cancer later on in one's lifetime. And then sometimes it's external things that we put in our bodies. Could be related to birth control, like hormonal contraception, whether that be pills or even a hormonal IUD, or even use of things like ibuprofen to help with various conditions. Those things can contribute to having abnormal uterine bleeding. Sometimes even herbal supplements, or if a patient is on tamoxifen for some reason, that can again be the cause of abnormal uterine bleeding. So we try to really put it in those specific buckets and categories that could be the real cause of why that person is having abnormal uterine bleeding. And the other one I forgot to talk about is infection. Infection is something that could be potential, right? Could be related to something called endometrioitis. cervicitis, sometimes sexually transmitted infections, as well as things called, or a specific condition called pelvic inflammatory disease. So those are the buckets that we tend to look at when we try to think about what can be the cause of the bleeding.
So when you're thinking about something like endometriosis, which should be it's different, totally distinctive from endometritis.
Yeah.
So with endometriosis, you would also have symptoms like pelvic pain.
Hmm.
If you are sexually active, you may have pain during intercourse. You may have incapacitating pain during and before and during your menstrual cycle. And you may also have more blood flowing during your menstrual cycle. So should women take into consideration, as an example, a diary that they would keep so that they would have a better understanding of what is going on during this period of time? And again, just focusing for the moment on endometriosis and thinking about a pain diary.
Absolutely. So I strongly recommend a pain diary and a bleeding diary, right? And I even encourage patients to keep them kind of together in the same booklet. And for pain, right, they want to characterize it based on how often it's happening, how long is it lasting, are there any medications, either prescription based or over the counter, that helps alleviates that pain? If the pain is, because sometimes the pain, especially even with endometriosis, it can be unrelated to when bleeding is actually occurring, right? So is bleeding occurring or not occurring? But I think that's a critical piece for women to come equipped with when they come to talk to their healthcare providers, having that pain diary as well as a bleeding diary that helps characterize their pattern of bleeding as well as the characterization of the pattern of pain as well. And the other thing is if they're having bleeding after intercourse. That's one thing I think is very important to note, and for patients or individuals and women to be aware of and to document if after sexual intercourse is there bleeding that's occurring, because again, that's not normal to happen, right? So being able to document that helps them come equipped when they see their healthcare provider that says to say when I came in, I wanted to let you know I had bleeding during this occasion, as well as after I had intercourse. That helps the provider be able to determine what potentially could be the cause of that.
And we know that with endometriosis, um, sometimes women will have pain with intercourse because it depends on the location of the endometrial adhesions. So if you have something called rectovaginal endometriosis, it may actually be in that area that is in the lower half of the endometrial area, and that may when there is pressure exerted, it may actually cause more pain. You mentioned adenomyosis, which is really related to endometriosis. And how does that manifest itself?
So again, an individual may have painful periods as well. Patients could even have painful intercourse with that. They could have abnormal uterine bleeding as well. Um, And again, it can be even a diagnosis that is a combination of the two. Like patients can have adenomyosis in the presence of endometriosis. Um, and again, helping to find out that diagnosis is based on having a good history of when pain is happening, when bleeding is happening, because it helps us as healthcare providers to be able to create those differential diagnoses to determine what potentially is the cause of not only just the bleeding, but the pain source as well.
And endometriosis, if you want a definitive diagnosis, they generally do it laparoscopically. So it doesn't necessarily have to be invasive, but they will do laparoscopic procedures so that they can make a definitive diagnosis. And it's really important to get that diagnosis made as soon as you possibly can. Unfortunately, it usually takes anywhere from can be 7 to 9 years to make that diagnosis, And much of this is because we still don't understand a lot about endometriosis. And this is why it's so important to keep a diary. It's so important to pay attention, as Dr. Moore said, to your symptoms by doing both a bleeding diary as well as a pain diary, and bring that to your visit so that your doctor can establish a better way of tracking what is really going on, and to recognize that and get therapy initiated sooner rather than later.
Absolutely. And just to give people an idea of what type of labs or tests could be done. So typically, initially for all patients, we may order something called like a complete blood count. We always want to rule out pregnancy. So we'll either do that through like a urine test or blood testing for the pregnancy hormone. We do like to do an evaluation of the endocrine system, specifically the thyroid functioning, just to rule out any things like hypo or hyperthyroidism. And we always want to check the ferritin levels to see the iron storage. So in addition to the CBC, which gives us like information about the hemoglobin as well, we do like to assess the ferritin levels to see how the iron storage is within the body. So typically, those are some labs that may be ordered for an initial visit. If there are things that are a little bit more concerning based on like the clinical exam at that time, sometimes other tests are ordered, something called a prolactin. And again, that has to do with the endocrine system as well. We sometimes test for other hormones that are related to the reproductive system, specifically your estradiol or your FSH. Those are additional tests that may be completed as well. We sometimes do a comprehensive metabolic panel. And if we think that potentially there could be things related to like infections, we may order testing for sexually transmitted infections. When we think about certain conditions like PCOS, we may do something called like a glucose tolerance test. And depending on the individual's age and risk factors, we may even do a sampling of the endometrial lining to test for changes in those cells to see if there are any things that are abnormal that could indicate endometrial hyperplasia or even endometrial cancer. So there are additional testing that will likely be done when a person does present, and it could be a variation of them. And sometimes even images are ordered. So maybe a pelvic ultrasound or MRI to get a better look of the uterine cavity to determine if there are any types of abnormal masses noted that could be present that's actually contributing to that bleeding. But those are some of the labs and or images that we as healthcare providers may order if a person does present with abnormal uterine bleeding.
We hear about the insidious nature of conditions, malignant conditions such as ovarian cancer, endometrial cancer, and sometimes the symptoms can be very confusing. Perhaps we could spend a couple minutes talking about ovarian cancer, because sometimes women who are past the age of menopause will still have vaginal bleeding, and that can be an early warning sign.
Absolutely. And ovarian cancer is one of the most deadliest forms of gynecological cancers. And I think, Jerry, you really pointed that out because of the symptoms. And symptoms can mask other, or can be, you think as a patient, they contribute into something else. So oftentimes people are diagnosed in later stages. Although if it's caught early, it can be treated and it can be cured, right? But we often find out later on. And the common symptoms that are related to ovarian cancer include abdominal. So a lot of people may have bloating or feeling full quickly. They may even have some abdominal pain or constipation, trouble with indigestion or diarrhea. So again, very vague and common symptoms that we can easily dismiss to something else. Some people may even have a loss of appetite, sometimes nausea and vomiting may be associated with it. They could have the urinary frequency because of that pressure based on the mass. And sometimes they just feel tired. They just overall may not feel well. And when we think about bleeding symptoms, vaginal bleeding is one of the symptoms related to it, and that's heightened if a person is postmenopause. So if they have bleeding after menopause, they definitely want to be evaluated for ovarian cancer. The other thing is if they're seeing their provider for their yearly well person or well woman exam, and the provider is doing something what we call a biennial exam. And on a woman who is postmenopausal, if you can palpate the ovaries, that typically warrants further evaluation, because usually on a postmenopausal woman, you wouldn't be able to palpate the ovaries. So that would warrant further evaluation to ensure that ovarian cancer isn't present.
So in the context of vaginal bleeding with some of these other symptoms could be a bit of a red flag for you if you're a postmenopausal woman.
Oh,
So you should pay
absolutely.
attention to that. What about endometrial hyperplasia, or sort of or something that would suggest a malignancy? Any symptoms that women should be attentive to in addition to vaginal bleeding?
I think if they feel fullness in the pelvic and abdomen or abdominal region is a reason to see your healthcare provider. A lot of the gastrointestinal symptoms, if they're associated with the vaginal bleeding, those are reasons to be evaluated. But I think the biggest key here is ensuring that at least once a year you see your provider to have your well woman or well person exam, because at that time your provider is looking at your vaginal tissues, they're looking at your vulval tissues, your external genitalia area. We are doing a speculum exam to see your cervix, to see if there are anything that is present there that could be contributing cause of abnormal uterine bleeding. I know pap screening guidelines have changed recently, so we don't necessarily collect the pap every year, but that once a year visit could be life changing for women, right? And I can even give an example. During my time in Pennsylvania, working at a health center there was a woman who came in. She was maybe 62. She hadn't been to see her provider in probably 10 years. And when she came in, she had bleeding. And at that time, I collected a pap smear and I collected, she had tissue already coming out. So I didn't even have to do a biopsy because tissue was coming out with the blood. Long story short, she ended up being diagnosed with cancer, a form of endometrial cancer. But I say if she had not come in, who knows if she would have gotten a diagnosis in a timely manner, right? So I always say it's important, even though PAP screening guidelines has changed, PAP screening guidelines don't necessarily correlate to coming in for your well woman or well person exam every year, because that's the critical time for you and your healthcare provider to discuss what's happening with your bleeding pattern, what's happening with your pain, even urinary symptoms, right? Urinary symptoms and bowel movement symptoms could be related to forms of GYN cancer, right? Or even some benign conditions. But if we don't see you at least once a year, we don't know the information and we can't get you appropriately diagnosed in a timely manner, right? In most cases, it's not cancer, right? Most cases, based on the data, between 50 and 80% of women will experience uterine fibroids in their lifetime. So lots of time is benign, but I would say very meaningful and impactful conditions like uterine fibroids, like endometriosis, like adenomyosis, that really can impact your day-to-day activities. But without us seeing you, we can't give you that definitive diagnosis and be able to recommend appropriate management and treatment of those conditions. But lots of the time, the conditions are benign. It could even be a cervical polyp or even an endometrial polyp. I just recently had a patient who did a biopsy on, and she actually had tissue related to a polyp in her endometrial lining that was contributing to the bleeding, right? So again, that once a year visit really is a critical visit that allows you to bring in the information that you've been experienced. Although you don't have to wait for the year, you can come in before the year, but at least once a year, we want to see you to be able to talk through that with you.
It's very good advice. We talk a lot about the pathology, and we're not here to scare women. We're here to have them pay attention to symptoms and to self-advocate, because we find that we're always apologizing for things. We have to stop apologizing. We need to show up with our authentic selves, bring in our diaries, make sure that we get the most efficient time when we are with our healthcare practitioner. They can't read our minds. I've said this 1,000 times on these podcasts. So pay attention to your symptoms. And by the way, if a woman is in menopause, she may have atrophic vaginitis and she may have bleeding,
Mhm.
not related to any pathology, but it could be that her tissue is dry and it's friable. So perhaps we could spend a couple minutes on that.
Absolutely. So it's completely normal for women who are menopause and postmenopause to have what you describe in we call vaginal atrophy, and that's thinning of the vaginal tissues because of the lack of production of estrogen. But there's things we can do to help support that, whether that be hormonal replacement therapy in the form of creams or pills or even patches to help support them. But yes, having the thinner vaginal tissues cause them to be a little bit more sensitive and they can break easy. And I always say, even if sometimes the friction of even just underwear can cause discomfort and potentially cause the tissue to tear and cause that bleeding. And I always say there are things we can do to help support that vaginal tissue during that time as well. But again, that could be a cause of the abnormal bleeding. But there are things we can do. Even vaginal moisturizers can be very, very beneficial. And typically, in my practice, it's the first line before hormones to see, or hormonal replacement therapy, to see if that consistent use of the vaginal moisturizers can help support that vaginal tissue having its elasticity to prevent it from breaking and tearing easily.
Yeah, absolutely. And we know that, as you mentioned, there are various options that are available. And for vaginal tissues, it can take up to 3 months, even if you're using hormone replacement therapy. If you're eligible and you're using something intravaginally, it can take up to 3 months for it to work. So in the meantime, to experience some relief, a vaginal moisturizer may be helpful. But you can also continue to use it. I always say, if you moisturize your skin every single day, all your skin. And sometimes we forget about the skin below the waist, but it is still skin, and it is actually more delicate than the skin on our faces, because it's the mucosal skin. So it's what you find in the mouth, right? And we know how easy it is for things to break down in the mouth. You get a mouth sore, it can drive you to distraction. Well, just imagine if you have something intravaginally. Can you imagine how horrible that feels? For a lot of women, there is an option that they can use right away. So great advice. And obviously, you still want to check it out. You don't want to necessarily assume that this is okay. Get to your healthcare practitioner, make sure that you have ruled out everything else. But it's most likely, if you're postmenopausal, menopausal, you're probably experiencing some vaginal dryness.
Absolutely. And I think the biggest thing with the vaginal dryness is most people need relief sooner rather than later. And we know, to your point, the hormonal methods take a bit longer. So I always say the vaginal moisturizer should be the mainstay. And then you add those other components to it. And as you mentioned, it's skin, it's tissue, but that's even a little bit more sensitive, right? That
Yes.
really needs to be moisturized on a regular basis. So I'm a key and huge supporter of use of vaginal moisturizers in combination with other methods, because that vaginal moisturizer provides relief sooner, and it's a more of a mainstay and consistent way for individuals to keep those vaginal tissues moist and elastic.
We talk about we also know that there are younger women who, because of trauma, may have vaginal bleeding. And if it's trauma that's induced by unwanted sexual activity, that's a totally different situation that needs to further investigation. If it is trauma because of vigorous sexual activity that is consensual, that may also cause some vaginal bleeding. And what do you recommend in that regard? So, what if that's your thing?
So I think what makes people most comfortable and safe, right? And that's why I always say, like, regardless of age, right? Even though we say vaginal moisturizers for individuals typically postmenopausal, right? To your point, people can be of younger age and still could benefit from vaginal moisturizers. And I've actually recommended them for patients who were not menopausal or in that postmenopausal phase for various reasons. Sometimes even from like a psychological and emotional perspective, they don't create enough vaginal lubricant to allow their tissues to become nice and moist on a regular basis outside of even sexual activity, right? So, what are things they can do? They can use a vaginal moisturizer regardless of their age. So, I always say, especially, I'm like, so go women, you have to use what makes you comfortable, right? And what helps your health overall, right? Regardless of your age, right? But I know historically, vaginal moisturizers and even lubricants have been supported for use of sexual activities or use for women of a certain age. But I mean, that's just a myth. If your vaginal tissues are not as moist, you can benefit from a vaginal moisturizer without being of women of a certain age, right? It's what makes you comfortable, which is the most important thing, because you can have younger people who, even if they're on a certain medication, lots of patients who may be immunocompromised for some reason suffer from vaginal dryness outside of sexual intercourse, just having not moist vaginal tissues that cause them to have discomfort, right? It can be as even just like I said, putting on underwear or wiping after they urinate, and they need to have a vaginal moisturizer or lubricant present to help their tissues not be as dry, right? So again, I always say you have to use what works for you, and that helps support you being your most healthy self. And so, yes, women who are younger, who may not be in that menopause or postmenopausal time frame, could certainly benefit from using vaginal moisturizer or lubricants because vaginal tissues could be dry for other reasons external to hormonal related to menopause or postmenopause.
And I think, as you pointed out, that could cause some vaginal bleeding. It may not be excessive, but it could, result in some vaginal bleeding. It could be tears to the vulva. It could be vaginal tearing. So all of those could contribute to bleeding, not necessarily a cause for significant concern. May not be a malignancy. So if you have vaginal dryness and you are experiencing some bleeding, it's most likely being caused by the fact that your vaginal tissues are dry and friable. But
Mm-hmm.
again, always see the healthcare practitioner. We can't make diagnoses over these podcasts. We never will. So the best advice is whatever you're hearing on these podcasts, be sure to check with your healthcare practitioner. This is informational to help you to self-advocate.
Absolutely. And the more information you can bring back in discussion with your healthcare provider can help you to come up with the best plan that's appropriate for your medical care.
So, Dr. Moore, what did we miss? We've covered a lot of territory regarding vaginal bleeding, what's normal and what's not. Any final tips for our audience, or is there anything that we may have missed?
I think we covered the landscape pretty good, Jerry. I think the key takeaway I would say here is what you brought up earlier about the use of your diary. I think it's so important to document what you're experiencing in terms of the amount of blood flow, the pain that's associated with it, and even any external symptoms unrelated to pain or bleeding that may be accompanying it. When you come equipped with that information, It helps you to be able to better advocate and inform what your experience and with your healthcare provider, so that you two can really develop a solid plan and course of action to appropriately manage the abnormal bleeding you're having that may be related to pain and or other symptoms. But I think the diary will be the key here.
Wonderful. You heard it from Dr. Shawana Moore, who has great expertise in women's health, has been the president of the Association for Nurse Practitioners in Women's Healthcare, and who comes with years of experience caring for women and girls. So, Dr. Moore, thank you so much for your time this afternoon. It's always a pleasure to have you on our as our guest on the Love Mia Vita podcast.
Thank you so much for having me, Jerry.
Take care, and we'll chat soon. Thank you for joining us on the Love Mia Vita podcast. Love Mia Vita means love my life, and that is a mantra we should all live by. Please like and subscribe wherever you get your podcasts, and remember to follow us on social media and on fempharma.com. Thank you, and be well.